This is the second video of the thorax series, and in this video I will be talking about the lungs and the pleural cavity. When we look inside the thoracic cavity, there are two lateral compartments. These lateral compartments are occupied by the lungs and the pleura. There is one central compartment. This is also known as mediastinum, middle septum, basically dividing the right lungs and the pleural cavity from to the left. Mediastinum contains the heart, the large vessels, the visceral column, which is trachea, the esophagus, and there are certain nerves like vagus, phrenic, and there are lymphatics and lymph nodes. Right pleural cavity and the left pleural cavity with the lungs are separated from each other. There are two parts to the pleura, the parietal pleura and the visceral pleura. The parietal pleura covers the thoracic cavity and the visceral pleura covers the lungs. Let me show you here. This white layer, which is covering the internal part of the thoracic cavity, is the parietal pleura. The area which is covering, or the layer which is covering the lungs, this area here, or this layer is called as visceral pleura. Between the parietal pleura and the visceral pleura, there is a space, and that space is a potential space, and it is occupied by a film of fluid which is called as pleural fluid. So this is the pleural cavity between the parietal pleura and the visceral pleura. Parietal pleura is sensitive to pain, while the visceral pleura is insensitive to pain. So let me demonstrate the formation of the parietal pleura and the visceral pleura by using my wrist, which represent the lung bud. My fist will represent the root of the lung. My left hand represent the chest wall, and the balloon represent the pleural cavity. The lung bud, which is the wrist, starts growing inside the pleural cavity. The layer of the balloon, which is around the right hand, becomes the visceral pleura. The layer of the pleura, which is near to the left hand, becomes the parietal pleura, and the space between those two layers is the pleural cavity, which is filled by the pleural fluid. If the knuckles represent the root of the lung, you can see that's where the parietal pleura and the visceral pleura are continuous one layer. Parietal pleura has four sections. There is cervical pleura, mediastinal pleura, diaphragmatic pleura, and costal pleura. They are named according to the area of the chest wall they are covering. Exception is the cervical pleura, which comes into the neck and covers the apex of the lungs. So let's look into this chest cavity, and the area which is shown here by my pencil is the costal pleura. It is covering the inner surface of the ribs, intercostal spaces. It reflects over the diaphragm and it is called as diaphragmatic pleura. The diaphragmatic pleura then reflects, changes the surface and comes to cover the mediastinal surface of the lung. It is called as the mediastinal pleura, and at the root of the lung, which is this area here, it reflects to become the visceral pleura, which is going to go over the lungs in the same way. The cervical pleura or cupula is the area of the lung which is lying inside the neck above the thoracic inlet. The cervical pleura covers the apex of the lung. Let me talk about the recesses. Recesses are the area in the pleural cavity where the lung does occupy during the inspiration. Or this is the area where the pleura reflects at an acute angle from one surface to another surface, forming a gutter-like spaces. There are two recesses, right and left costodiaphragmatic recess. So this is the area of the right costodiaphragmatic recess. The costal pleura comes down and reflects acute angle over the diaphragm. This creates a space on the right side, right costodiaphragmatic recess. Similar spaces on the left side. These are the area clinically where the fluid collects. There is another small recess which is called as costomediastinal recess. I am pointing with my pen here. So the costal pleura comes down and it reflects to the mediastinal surface, creating a space in this area here, and that is the costomediastinal recess, and that's the only one on the left hand side. So on these dry lungs, I am going to show you some of the features. The apex of the lung, somewhere around this area where not very well marked is the impression of the first rib. You can see the apex of the lung lies in the neck above the thoracic inlet. Anterior border of the right lung, anterior border of the left lung. If you follow the anterior border, there is a depression here, and that is called as cardiac notch. Following the cardiac notch, this area here is called as lingula, almost like a tongue, tip of the tongue. If we take the lung and look at the inferior aspect, this area here is the diaphragmatic surface, and it lies over the right and the left dome of the diaphragm. The area, the surface area which we are looking around with my pen here, this is the mediastinal surface. On this side here, the left ventricle lies. On this side here, it is the impression, or the right atrium is going to lie in this area here. Let's take it on the posterior aspect. This is the posterior border, costal surface of the lung on each side. These fissures which are obliquely going on each side are the oblique fissure. They divide the lungs into upper lobe and the lower lobe. And you can see how the lower lobe will be occupying most of the area of the posterior thoracic wall. So lower lobe can be easily auscultated on the posterior aspect, while on the upper part of the thoracic wall only we can see a little bit of the area of the upper lobe. Another feature which is only found on the right lung is the horizontal fissure. The horizontal fissure divides the upper lobe into a upper and the middle lobe. So there are 3 lobes on the right hand side: upper, middle and lower. On the left side, the upper and the lower lobe. So this is the right lung. We can see the upper lobe. There is a horizontal fissure, middle lobe. On posterior aspect, we can see the lower lobe. Let's see on the mediastinal surface, which is this area here. On the mediastinal surface, we can see in the middle here, this is called as the root of the lung, and the root is formed by the primary bronchus and the pulmonary artery and the pulmonary veins. The area of the lung, which is where the root of the lung is entering, is called as hilum, or the doorway. In this area here, on the inferior aspect, there will be a sleeve of pleura which is called as pulmonary ligament, where the parietal pleura will come to the root and reflect and become the visceral pleura. Talking about the visceral pleura, on the mediastinal surface, I can show you there is the area where we can see the visceral pleura. It almost adheres to the surface of the lung. On this prosection, let me show you the different part of the parietal pleura. This is a sagittal section. Orientation is superior, inferior, the diaphragm, anterior chest wall and the posterior chest wall. We are looking from the right side, root of the lung. Covering the anterior chest wall is the costal pleura. This pleura goes in the neck and becomes the cervical pleura. Covers the mediastinal surface here and called as mediastinal pleura, and this mediastinal pleura will reflect around the root of the lung and become the visceral pleura. Again, this area is the costal pleura. This costal pleura is reflecting here over the diaphragm and becoming the diaphragmatic pleura. This groove or this gutter here is the right costodiaphragmatic recesses. So on this chest plate, I'm going to show you the costal pleura. The costal pleura is covering the anterior chest wall here and over the intercostal muscles. This is the innermost muscle, and this shiny layer which is being sort of I'm picking up right now is the costal pleura, which covers the intercostal spaces here over the innermost layer as well as the ribs. So on this prosection, I'm going to show you the relationship of the two major nerves in the thoracic cavity, the phrenic nerve and the vagus nerve, to the relationship of the root of the lung. Orientation of this prosection: superior, inferior diaphragm, anterior chest wall, posterior chest wall. We are looking at the right side of the body. The root of the lung, the structures forming the root is this is the right primary bronchus, pulmonary vein, and the pulmonary artery. Anterior to this root, on the right hand side, this nerve, which is, we can trace it all the way to the diaphragm, is the phrenic nerve, coming from the C3, C4, C5 level. Posterior to the root of lung, the structure which I am holding right now is the right vagus nerve, forming the esophageal plexus over the esophagus. This is esophagus running down in the posterior mediastinum. Superior to the root of lung, I am pointing to the arch of azygos, the azygos vein coming and draining into the superior vena cava. So this is the structure which we are looking here. This is the right atrium of the heart where the superior vena cava is draining into. So we are looking at the right lung, apex of the lung, anterior border, diaphragmatic surface, mediastinal surface, root of the lung, pulmonary artery, pulmonary veins. Probably we can see these are the lobar bronchus going into the lower lobe and the upper lobe, lymph nodes. Also we can see the horizontal fissure, oblique fissure. When I am piercing the lung, the first layer I am piercing is the visceral pleura. So on this model, I am going to show the surface projection of the lung and the pleura. As a rule, pleura always lies 2 ribs below the lower border of the lungs, mid-clavicular line. So this around this line, the lower border of the lungs are going to lie on at the 6th intercostal space or 6th rib. 1, 2, 3, 4, 5, 6, and this is the lower border of the lung, while the pleura will be lying around the 8th rib. In the mid-axillary line, which is this line here, the lungs are going to lie on the 8th rib, and the pleura is going to lie on the 10th rib. On the back here, which I can't show you, on the mid-scapular line, the lungs are going to lie at the 10th rib, and the pleura is going to lie at the level of the 12th rib. So let me talk about the mediastinum, the middle septum, or the central area of the thoracic cavity, separating the right and the left pleural cavity and the lungs. This area can be divided into 2 major parts, a superior mediastinum and inferior mediastinum. The boundary of the superior mediastinum is the superior boundary is the thoracic inlet, which is formed by the first rib, and the inferior boundary is the sternal angle and a plane which is crossing from the sternal angle all the way to T4, T5 vertebra on the posterior aspect. So everything is, all the structures in this area, all around the thoracic cavity, in the central region, will be in the superior mediastinum. The structures below the sternal angle all the way to diaphragm are in the inferior mediastinum. So inferior mediastinum, this area from here, from sternal angle to the diaphragm, is divided again into three subdivisions: anterior mediastinum, middle mediastinum, and the posterior mediastinum. Anterior mediastinum is not very clinically important. That is just the area behind the body of the sternum. Middle mediastinum is the area which is basically within the pericardium, that is the heart, the part of the blood vessels, and the posterior mediastinum contains the structures which are coming from the superior mediastinum and going into the abdominal cavity, which basically contains the esophagus, the trachea, the vagus nerves, also the thoracic duct, etc. If I remove this heart here, we can see some of the glimpses of the posterior mediastinum behind the fibrous pericardium. We can see the thoracic aorta, descending aorta. There is the esophagus.
Wade in the water, wade in the water, children, wade in the water, and God's gonna trouble the water. Who's that standing dressed in red? Wade in the water, must be the children that Moses led, and God's gonna trouble the water.